Hello guys, welcome to my channel. This is Gina, a health professional. Today I'll be teaching you on another interesting topic known as peptic ulcer disease. Before I continue, I would love you to tap on the subscription button, like, comment and share. Do you know that 5 to 10% of the total population worldwide will develop peptic ulcer? And this can actually develop at any age. Now, this takes us to what is peptic ulcer disease? Peptic ulcer disease is a common condition that causes ulcer or sore in the lining of the digestive tract. Now, I'm going to break it down for you how peptic ulcer occur. There are two stomach juices that help to chemically break down food substances for digestion, which is the pepsin and the hydrochloric acid. Usually, these juices are supposed to be corrosive, but thank God, the gastrointestinal tract has been designed to have a mucous lining that protects the stomach from this corrosive juice. But when the protection fails, these stomach juices will erode the mucous lining in the stomach, thereby leading to peptic ulcer. I'm going to be telling you some of the signs and symptoms of peptic ulcer disease. There might be abdominal pain, indigestion, loss of appetite, bloated stomach, nausea and vomiting. There might be weight loss. Before I continue, I hope you have clicked on the subscription button. Clicking on the subscription button will make you get a notification each time I go live or each time I post a new video. Now back to the topic. If you can remember, I said the gastrointestinal tract has a protective mucous lining that protects the stomach from this corrosive juice, but this protection can fail. Now I'm going to be telling you things that can make the protection to fail, that can cause you having a peptic ulcer disease. One of them is H. pyloric infection, which is a major cause of peptic ulcer disease. What is H. pyloric infection? Helicobacter pyloric infection. Nearly half of the world population have this bacterial infection living in their stomach or in the duodenum. But in most people, this doesn't seem to cause any problem. But when this bacteria overgrows to interfere with the natural balance of the microbes, this can in turn cause chronic inflammatory response in the GIT, that's the gastrointestinal tract, thereby causing diminishing of its resources for self-repair, leading to peptic ulcer disease. Another cause of peptic ulcer disease is the overuse of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. These are common OTC drugs that you can get from your roadside chemist, that you can get from a medical shop, that you can get from the pharmacy without doctor's prescription or without the advice from a professional personnel. It is very easy to abuse this drug. Now, example of these drugs are your pain relievers. They are your drugs like aspirin, drugs like ibuprofen. Abuse of this drug can cause effects of the normal chemistry in the stomach, thereby causing or thereby exposing one to peptic ulcer disease. Now, there are some medical conditions that can also predispose one to having peptic ulcer disease. Conditions like Crohn's disease, conditions like stomach cancer, conditions like Zollinger-Ellison syndrome. Some of the investigations that you can do to diagnose if you have peptic ulcer disease. One, you can check for H. pyloric infection. You can do a CT scan, you can do X-ray, you can do biopsy or endoscopy. Now I'll be telling you the prevention of peptic ulcer disease. You have to protect yourself from infection by washing your hands regularly. Eat food that are well cooked and prepared. You have to avoid the intake of tobacco, avoid the intake of alcohol, stop smoking, reduce the use of NSAIDs. Do not abuse drugs. Do not overuse drugs. You have to go to the hospital or seek advice from a health professional. Ways you can manage peptic ulcer disease. One is with your medication. The combination of antibiotics or proton pump inhibitors can help you treat peptic ulcer disease. And then there are ways that you can actually prevent some of these crises, some of these signs and symptoms of peptic ulcer disease like abdominal pain and the rest, bloated stomach, indigestion. One, you have to adjust your lifestyle. Like I said before, you have to stop the intake of alcohol, stop the intake of tobacco, no caffeinated drinks. You have to limit fatty foods, fries, limit oily meal. You have to limit carbonated drinks. You have to avoid too spicy food. You have to avoid citrus food that has citric acid, fruits that have citric acid. You have to avoid eating late. At least you eat 3 hours before your bedtime. You have to sit in a good position while eating. You don't have to lie down when you are eating. You have to sit upright when you are eating. Then you have to eat small frequent meal. You don't have to consume too much at a time. You eat small frequent meal, like 4 to 6 times a day, instead of eating a regular 3 times bulk meal. Yes. So if you find this video very interesting, if you find this video useful, please subscribe, share, like, and comment. Thank you.